Good morning, everyone. I am Ayeen Falle, together with my co-members, Caitlin Marie Boncalon, Ashley Mae Gelisanga, Nicole Gonzales, Jessa K. Torres, and Esther Belle Tubola, and our research title is Unveiling the Mystery, the challenges on how private nurses handle the amount of COVID-19 patients during the pandemic in Bacolod City. Background of the study. Private nurses are one of the most important persons when it comes to the field of medicine. The field of medicine is widely regarded as one of the most demanding professions globally. The COVID-19 pandemic has caused an unprecedented strain on private nurses internationally. Rising infection rates, inadequate personal protective equipment, and the lack of availability of hospital beds has resulted in further deterioration of already fragile mental health of healthcare workers. The COVID-19 pandemic is the most serious global threat to public health in a century. The first reports of a cluster of novel coronavirus came in December 2019 in the Wuhan city of Hubei province in China. Due to the proximity and various links to China, COVID-19 has badly hit Asia early on, along with several Pacific Island countries. As of October 5, 2020, cumulative cases in the region have reached over 8.3 million, and the deaths have reached over 140,000. Private nurses experience immense pressure due to the overwhelming number of patients, shortage of resources, and difficult decisions related to triage and treatment. COVID-19 pandemic has caused an extraordinary situation, especially for the healthcare workers, leading to increased psychological stress. As precautionary measure to reduce transmission of this virus, jobs, airports, and many schools have closed down with a few that resorted to online studies.
Purpose Statement. The purpose of this phenomenological study is to explore the experiences of private nurses during pandemic in Bacolod City. Specifically, this study aims to answer the question, what are the different challenges that these private nurses experience during COVID-19 pandemic?
Significance of the study. This study focuses on how the private nurses handle the amount of COVID-19 patients during the pandemic in Bacolod City. This study would be significant to nurses, hospitals, people in communities, teachers, parents, students, future nurses, and to the future researchers. This study will be beneficial to nurses as it will provide essential insights for improving their support, training, and overall well-being. This study will benefit hospitals by offering perspectives to enhance the effectiveness and support for nurses dealing with the demands of caring for COVID-19 patients. This study will benefit the people in communities by shedding light on the challenges nurses faced during COVID-19, fostering greater support for their vital roles in public health. This study will be beneficial to teachers in educating their students about the significant challenges faced by nurses during events such as COVID-19 pandemic.
Scope of the study. The study conducted in Bacolod City focuses on the lived experiences of private nurses handling COVID-19 patients, highlighting their struggles, resilience, and dedication amidst the challenges posed by the pandemic. Private nurses face high-stress environments, long hours, and emotional tolls while providing essential care. Despite risks to their own health, they remain dedicated to serving the community, showcasing remarkable selflessness and commitment amid to the rising threat of COVID-19.
Methodology. This chapter presents the methods and procedures employed in this study, which includes the research design, sampling technique, participants, research instruments, data collection, and data analysis. Research design. This study will utilize the descriptive phenomenological research design. The use of phenomenology is appropriate for exploring the lived experiences of private nurses during COVID-19 pandemic, since it focuses on exploring the personal and individual experiences of the participants. In the analysis stage, the modified Bandcam methodology described by Mustakas 1994 will be utilized. This method includes 7 interrelated steps that consider participants' transcripts as a whole and as an individual. Philosophical assumption. An understanding of the philosophical assumptions behind qualitative research begins with assessing where it fits within the overall process of research, noting its importance as an element of research, and considering how to actively write it into a study. Ontological. The researchers believe that private nurses face significant challenges during the pandemic due to the heightened risk of COVID-19 transmission. Despite these risks, nurses exhibit resilience and dedication as they care for patients. Their experiences prompt researchers to explore the paternal challenges of the pandemic.
Epistemological. The study, led by senior high school students aspiring to be medical professionals, aims to understand how individuals perceive and navigate the world using a social constructivist framework. Inspired by private nurses' experiences during the pandemic, the researchers seek to explore how these professionals utilize their expertise to confront challenges and care for COVID-19 patients amidst chaos and risk. Methodological. The researchers will employ descriptive phenomenology using the modified Van Kaam analysis by Mustakas to delve into the experiences of private nurses amid the COVID-19 pandemic. Through participants' interviews, the study aims to uncover common themes related to workloads, stress, and coping mechanisms. The narrative-driven approach will yield new insights, shaping the study's conclusions. Ethical considerations will be prioritized to ensure respectful treatment for nurses' stories. Axiological. The researchers deeply value compassion, selflessness, and dedication, especially in the face of significant personal risk, as witnessed through the experiences of private nurses during the pandemic. They see nurses as genuine heroes, embodying sacrifice and unwavering commitment to saving lives. A quote by Rousey Williams underscores the unique role of nurses in facing challenges that few others would undertake. Their exemplary dedication and adherence to ethical standards serves as an inspiration during times of crisis. Participants. This study focuses on the 10 private nurses that participated in handling the COVID-19 patients. Using the purposive sampling method, 10 participants were identified. Purposive sampling is the process of randomly choosing samples from a population that can best serve the goals of the study.
Research instrument. An in-depth interview will serve as research instrument of the study. Qualitative research technique involving the collection of data through questions. 2 more participants will engage in the interview, with one acting as the interviewer. Additionally, researchers will also use cell phones for audio recording during the interview process, which will later use for transcription. Bond papers with interview question and pen will also be used during the interview process and will serve as guides while questioning the participants. Data collection procedure. The researchers initiated the data collection process by sending transmittal letters to private nurses in Bacolod City, seeking permission for structured interviews to explore the challenges faced during COVID-19. During the interviews, participants were encouraged to openly share their experiences, with researchers adopting an open-minded approach and using probing questions to delve deeper. Interviews were recorded with consent, and both verbal and nonverbal cues were observed to enhance clarity and trust. Participants were thanked for their participations and assured of confidentiality. Transcriptions of the interview were thoroughly examined before data analysis, focusing on the core responses of the participants. Data analysis procedure. The modified Van Kaam analysis described by Mustakas will be used to analyze the participants' transcript. The analysis will follow the 7 steps laid out by Mustakas. 7 steps are as follows.
Horizontalization. This is a meticulous process in research where verbatim transcriptions are carefully reviewed and reiterated to organize and categorize significant participant responses. This includes capturing words, phrases, sentences, and emotional reactions to ensure comprehensive documentation of relevant information. Researchers maintain objectivity by refraining from preconceived notions about the issue, a practice known as bracketing. Reduction and elimination of data. The focus on minimizing irrelevant information among private nurses during the COVID-19 crisis. Reduction and elimination of data. The focus is on minimizing irrelevant information among private nurses during the COVID-19 crisis. This involves adhering to health authority guidelines and removing data deemed irrelevant, such as personal opinions, unrelated experience, administrative details, patient information not pertinent to the research, and tangential discussions. Only verbatim transcriptions crucial for research objectives and relevant to the phenomenon are retained. Clustering and thematizing. Interconnected elements that remain constant are grouped into thematic categories. These categories derived from the analysis represent the central themes of the data, reflecting the shared perceptions and experiences of private nurses who cared for a large number of COVID-19 patients during the pandemic. Validation, ensured through comprehensive data collection and member checks, enhancing internal validity. By focusing on private nurses and having a diverse participant sample, the study suggests potential applicability to similar urban settings dealing with high volumes of COVID-19 patients, thereby enhancing external validity. Construction of textural description. In this step, textual descriptions describe the participants' distinct experiences. These will be built with the pertinent, confirmed invariant themes and elements, along with the exact quotes taken from the transcription.
Construction of structural description. In this step, researchers need to creatively embed the phenomenon within a specific context. The different viewpoints of each participant on the said phenomenon will be described. Incorporating the textural and structural descriptions into themes. This final stage culminates in the creation of a comprehensive report with all the themes. These themes embodies the assessment's conclusion, tying back to the study's original objective. This step aims to deliver the participants' collective experience in unison. Trustworthiness. The researchers prioritize precision, consistency, and comprehensiveness in data analysis, demonstrating reliability, objectivity, and adaptability in assessing nurses' performance. This is achieved through meticulous documentation, clear communication, and adherence to established protocols. Trustworthiness, as outlined by Lincoln and Cuba, is assessed through criteria including credibility, transferability, dependability, and confirmability, indicating the validity and reliability of the study. Credibility. Credibility in the study will be ensured by aligning participants' views with the researcher's representation. This will be achieved by encouraging participants to provide accurate and detailed information while ensuring confidentiality. Probing questions will aid in eliciting expanded responses regarding their experiences as private nurses during the pandemic. Debriefing at the interview's conclusion will underscore the significance of the shared data in achieving the study's objectives. Transferability. Transferability in this study refers to the ability to generalize the results and apply them to the other contexts or settings. This is facilitated by providing thick descriptions of both the behaviors and experiences of the participants, as well as their context, making the findings more meaningful. In the study on the lived experiences of how private nurses handle the amount of COVID-19 patients during the pandemic, the researchers will offer a rich account of descriptive data, methods, procedures, and interview transcriptions to enhance transferability.
Dependability. Dependability ensures consistency in research. In this study, the process will be logical, traceable, and well documented, with all data preserved until completion. The research will follow the Van Kam method strictly for stable findings. Conformability. Researchers will document every decision taken throughout the process, including reflective thoughts, research materials, and other crucial information to demonstrate how interpretations and findings will come. Ethical considerations. Social value. The researchers believe that it is relevant to explore the lived experiences of private nurses during pandemic. Every nurse, especially the ones who were there during pandemic, shares different experience in dealing with their patients. Informed consent. This covers everything that should be communicated to participants in this study, including details about the study's nature, scope, and objectives, how long it will take to complete the survey, whether respondents are willing to participate, and what will happen with the collected data. Vulnerability of the research participants. The essential for identifying the various ways includes recognizing the potential risk they face and the means by which researchers can address these vulnerabilities to ensure the safety and security of all involved.
Risk and benefits. The research offers valuable insights to enhance support systems, inform healthcare practices, and recognize the human cost of the pandemic on private nurses. However, participations may pose emotional risk for participants as they revisit stressful experiences. To protect participants, researchers prioritize informed consent, confidentiality, and offer post-interview supports. Privacy and confidentiality. These are prioritized in the research, with the participants' information kept private and secure. Biases or codes will be used to protect their identity. Participants will be respected for their independence, allowing them to share experiences freely, while transparency will be maintained throughout the research process.
Justice. It is upheld in the study on the challenges faced by private nurses during the pandemic, with a commitment to ethical standards and fairness for all participants. As a token of appreciation for their contributions, each participant will receive a certificate of recognition acknowledging their commitment to advancing understanding of this critical issue. Transparency. This outlines the various factors that need to be clearly understood in the study, such as payment amount or the compensation the author will receive. Qualifications of the researcher. The researchers must possess open-mindedness, patience, sensitivity, and a broad understanding of nursing to effectively uncover deeper understanding and create a safe space for private nurses to share their COVID-19 stories. These qualities enable researchers to navigate unexpected experiences, emotional weight, and complexities that participants may face during the study.
Adequacy of facilities. The researchers employ various tools to interact with respondents. Through high-quality search methods, researchers approach respondents and utilize additional information, often using laptops, cell phones, Wi-Fi, and etc. Community involvement. The community involvement in Bacolod City's private nursing challenges during COVID-19 could include volunteer support, resource mobilization, education, mental health support, and advocacy for better working conditions.
And these are the references we cited. Thank you for listening.